2.2 Introduction. In Unit 1 you have learned about the meaning of counseling. You also learned about who is a counselor and what do they aim at achieving in counseling. In this unit, you will learn about how they go about attaining these goals of counseling. How does counseling happen and progress? In other words, what is the process of counseling? Counseling is a professional relationship which needs to be well defined and structured so that the goals set during counseling can be achieved. A therapeutic relationship needs to be built between counselor and client, which facilitates trust, confidence and a safe space for the client to open up and share their difficult emotions, anxieties, conflicts and challenges. Addressing these issues is aimed to bring positive outcomes in counseling. 2.3 Counseling process. The counseling process is dynamic in nature. It is not a one-time event but a process consisting of a series of steps with a beginning, a middle and an end, where the counselor facilitates the client to understand different aspects of their life which they wish to change or modify or face difficulties in. There is a natural progression that takes place within the context of the helping relationship between the client and the counselor. In the process of counseling there are definable stages with recognizable transitions, starting with relationship building, assessing the situation /problem, setting the goals, selecting, and using counseling strategies to bring about the desired results, and finally, termination and follow-up. In the counseling process, realistic goals are established and options are explored by the client with the help of counselor. Together, they make the goal as specific as possible because it helps in achieving it faster. All these happen in the context of a therapeutic relationship of trust which helps the clients to identify their difficulties, concerns, fears and apprehensions and address these during the counseling process. 2.3.1 Importance of counseling process. The counseling process progresses through different stages which are not discrete but continue simultaneously. It takes time to build up a relationship of trust between the client and counselor. It does not form overnight. It is a developmental process which progresses towards reaching to a conclusion or resolution of problem. The most significant element of the counseling process is the client-counselor relationship. As stated by Rao, uniqueness commonness comprises an important dimension of the counseling relationship. It is unique in terms of the attitudes, beliefs, characteristics, and background of client and counselor. It is common in terms of the generic and objective aspects of the client-counselor relationship. For instance, it includes the cognitive element of eliciting information and analyzing these, and cognitive elements of expression feelings by the client. The process of counseling helps the client learn problem solving and better decision making. It can help the client in different aspects of life such as personal, social, academic, or career concern. It can assist the clients to enhance their self-confidence, intrapersonal and interpersonal skills, and communication skills. It can also make the clients define their career goals and path and acquire a deeper awareness into their and others' beliefs, feelings, behavior, perspectives and needs. Counseling can help them to establish meaningful and happy relationships with others and cope with day-to-day life stress and other negative feelings more effectively. Counseling is an active process where the client actively participates in the counseling session as well outside of the session to develop new insights and skills and make needed changes. The entire process of counseling is to enable the client to explore his/her concerns or difficulties or distress and to make his or her own decisions with the help of the trained and qualified counselor. The counselor does not provide advice or suggestion to the client. Rather, the counseling process aims at shifting the client's perspective from an attitude of victim to feelings of control over their life. 2.3.2 Stages of counseling process. Counseling is an active process influenced by various theoretical perspectives. Process can refer to the progression or development from one stage to another with recognizable transitions where counselor and clients understand each other and form a trusting relationship, assess the needs and situation, set realistic and achievable goals and form a workable plan to bring about the desired positive outcomes. The natural progression from one stage to another is known as the counseling process. The process of counseling decides the success of counseling, and it starts with forming a rapport building, moving towards identifying the problem, goal setting, interventions, and then finally reaches to the termination and follow-up. Various counseling skills are used during this process. Let us now discuss the various stages in the counseling process. 1. Rapport establishment. The first stage in the process of counseling is building a relationship between the counselor and the client, which is a continuous process. It is also known as rapport building stage, which is considered as the foundation of counseling. The counselor begins with establishing the environment conducive to build mutual trust and respect, where the client can feel free to have open communication about his/her issues/insecurities or fear. Genuineness, respect, empathy, effective communication, and being open-minded by the counselor will facilitate a psychologically safe, secure and supportive environment and a trusting relationship. The counselor needs to assure confidentiality and have a non-judgmental attitude towards the client. The counselor must keep it in mind that the purpose of counseling is to develop a therapeutic relationship which helps in identifying the needs of the client and assist the client in taking responsibilities for his/her problems as well as its decisions or solutions. The initiation of counseling process begins with the following important goals on the part of counselor and the client. Counselor needs to create a comfortable and positive relationship with the client. Brief about the counseling process and shared responsibilities to the client. Facilitate trust, open and an honest communication. Find out and substantiate the client's concern that brought him forward/her to seek counselor's help. Plan the strategies to get needed information or assessment data for continuing with the counseling process. Client needs to understand and clarify, if required, the counseling process and his/her responsibilities in the process. Share and explain the reasons for seeking help and cooperate in the assessment for understanding the problem/issues and self. 2. Understanding and assessing the client's problems. The second stage is the problem assessment stage. In fact, understanding of the client's problem starts during the process of relationship building itself. Assessment holds a crucial place in the process of counseling. During assessment process, information about the various aspects of the problem and about the person facing the problem as well as an understanding of the context is gathered. The process of assessment involves various skills such as observation, interviewing, taking case history, noting of information, forming hypothesis, etc. The counselor needs to collect extensive details about all aspects of the client's life. The gathered information must be validated by cross-checking from other significant people in client's life such as family members, peers, colleagues, co-workers, etc. since the presenting or outwardly observed problems may be just the tip of the iceberg and may be used as a concealment for the deeper or actual issues. Once the client develops the trust and feels accepted, they may share their deeper issues, conflicts, doubts, fears, and insecurities. Thus, it is important that the counselor uses an appropriate assessment procedure to find out the deeper problem and understanding about various issues. Taking case history and interview. Taking history is an important step in assessing and defining the problem the client is facing. The process of taking history usually starts with collecting standard identification data about the client, such as name, age, sex, address, socio-economic status, education, etc. Apart from this, it is also important to note the presenting problem, symptoms, and behavior of the client. It is also important to note down the physical appearance, verbal, and nonverbal cues. Sometimes the body language and gestures can reveal more than what the client tells. Before the process of taking case history, the counselor needs to assure the client about the confidentiality and security of the personal information shared by the client to the counselor. It needs to be reinforced that no information would be revealed to anyone without the permission of the client. The counselor notes down the present problems and past problems, if any, treatment, or help sought out before coming to the present counseling. Developmental history, medical history, and educational/occupational history of the client are taken. If needed, the counselor may interview clients' relatives and friends after taking consent from the client. It is also important to note that the counselor should follow the ethical guidelines and legal rules pertinent for retaining such personal information of the client. Along with case history and interview, the counselor may use certain standardized tests to diagnose the problem. Thus the counselor gathers as much relevant information as possible through different methods and different sources and integrate it to understand the overall picture of the client's needs and concerns. This understanding is shared with the client, as counseling process is a collaborative journey where the client also needs to develop self-understanding and self-responsibility for the change to happen. The counselor can use the following steps to identify and explore problems of the client. 1. Describe the problem. Identify the problem and define it very clearly, specifically and objectively. Find out the contributing and maintaining factors of the problem, severity and duration of the problem. 2. Explore the problem. Gather the information about the problem through different sources and methods. What all methods or ways clients have tried, which did work or which did not work, its background, etc. 3. Integrate the information. Systematically organize and incorporate all the gathered information to make it meaningful that will help in understanding the client and his/her problem clearly, and also to diagnose the problem and plan the possible course of action. 3. Diagnostic formulation. The next step in assessment is formulating the diagnosis. Counselors' clinical decision-making will help in the process of formulating a diagnosis. The counselor/practitioner uses the information gathered from the case/medical history and interviewing the clients and significant others. They observe physical characteristics and conduct mental examinations and or psychological tests to develop a list of possible causes of the problem or the disorder, which is also known as making differential diagnosis. The counselor then decides what strategies or action must be planned and taken to help the client. Sometimes even after therapy/counseling has begun, the list of possible diagnoses may be revised further if the client does not progress as expected. The purpose of assessment and formulation of diagnosis is to help the client set goals and initiate action. If the client and the problems are correctly understood and the assessment is made properly, it can help in identifying the client's resources and ability to bring about the changes and to set realistic goals of counseling. This further helps in choosing appropriate therapy/counseling to be provided by the counselor. 4. Goal setting in collaboration with the client. Setting goals is an important step to get structure to the entire counseling process. It provides a structure and direction for the counselor and client. The goal represents the desired outcome. Knowing that there is a goal to be reached through the counseling process generates a sense of hope and motivates the client. This in turn helps the client work towards realistic resolution of the problem and determine what can be achieved. Goals also help the counselor to validate the outcomes of the counseling sessions. Both the client and the counselor need to work in close collaboration to achieve the results. The main function of goal setting is to motivate, educate, clarify, and evaluate. 5. Selecting and applying counseling strategies. Once the client and the counselor are able to identify goals, the next question is to accomplish these goals. The counselor needs to identify and plan strategies or techniques to bring positive changes in the client and to enable them to resolve their difficulties and live more effectively and happily. The selection of counseling technique or intervention will depend upon many factors such as the counselor's theoretical or philosophical orientation, the skills and the insights of the counselor in using a particular technique, nature of the client's problem, nature of the client, the insight gained by the client, the time client is having for counseling, etc. Sometimes a client will report on useful efforts they have already made, and then such interventions or efforts can be further modified and tried during counseling sessions. 6. Termination and follow-up. Therapeutic relationship between client and counselor is not permanent and lasting relationship. Successful counseling has a criterion of successful termination as well. Termination is an important though often misunderstood phase of counseling. This is often ignored or taken for granted. Abrupt and unexpected break in relationship may become traumatic for a client, therefore, the counselor should prepare the client for the termination, as this helps the client to mentally prepare himself/herself for ending this important, secure, and trustworthy relationship. Some counselors as well as client may feel attached to the relationship and may feel uncomfortable ending it. The client may feel insecure to end the counseling relationship. Therefore, counselors need to plan for termination once the client reports some significant gains from counseling. The counselor can start preparing their clients gradually for closure by making statements such as, "It seems that now you are gaining good insight and skills to deal with your problems on your own. Maybe very soon you may not require counseling." Some clients may get upset at the possibility of facing their problems without help, but they may accept it if the issue is discussed gently and gradually. It is also advisable to make a follow-up appointment, which would give them a sense of security and hope they are likely to meet the counselor again and may contact the counselor if needed. It is also scheduled for various reasons including evaluation, research, or checking the progress with the client. A formal termination of these counseling sessions serves 3 main functions. Counseling is finished and it is time for the client to face their life challenges on their own. The client has gained the insight into his problems and coping strategies. He has matured and thinks and acts more effectively and independently. Skills and strategies learned during counseling session and changes which have taken place have generalized into normal behavior of the client. 2.4 Factors influencing counseling process. Counseling is not a linear process, rather a dynamic process affected by so many factors. Understanding these factors can help the counselor to work on these and make the process more effective and beneficial to the client. 2.4.1 Physical setting / contextual factors. To make the process of counseling effective, it is important to have a physical setting or the context which provides a place of confidentiality and feeling of safety to client to begin with. Although there is no universal standard that a counseling room should have, yet there are certain optimal conditions which can be created to have a conducive environment for both client and the counselor. The counseling room should have comfortable sitting arrangements with good ventilation and right temperature. The room should have enough lighting and with soft and soothing color. It should not be too cluttered as it may deviate the attention of the client. It should be a place where privacy and confidentiality can be maintained. If it is near the main office or in view of public, client will hesitate to approach. It should not be in a noisy place and no disturbances or distractions should be there. The sitting arrangement should be in such a way that the distance between client and counselor feels comfortable to both. Presence of table or any other furniture in between the client and counselor may create a physical and psychological or symbolic barrier which can affect the rapport building between the client and counselor. The sitting arrangement could be arranged at a 90-degree angle from one another so that the client can either look at the counselor or straight ahead. Different variations in physical setting can be adapted based on the client/counselor's comfort level, available resources and most importantly, the socio-cultural context. The counselor should make sure that the session should not be disturbed or interrupted during counseling. The counselor should put the phone on silent mode and can display Do Not Disturb sign outside the room for undisturbed session. In addition to the physical setting, the counselor should keep solar technique in mind while attending the client to initiate a better relationship building and listening. These are as follows: S. Face the client squarely, that is to have a posture of involvement. O. Have an open posture. Sit with your hands open and kept on your lap or on side of arms of chair, feet on the ground. Don't cross your arms or legs. L. Lean forward, at 60 degrees, towards the client but be aware of their personal space needs. E. Maintain appropriate eye contact. Looking at the person suggest that you are interested and concerned. But don't stare or look away or down, which may be perceived as disinterest or boredom. R. Relax when you interact with client. If you are tensed, the client will find it difficult to relax and trust in your abilities as counselor. 2.4.2 Process factors. The process of counseling can be facilitated by putting in a structure to it so that the client is clear of what to expect in the counseling process. The structure gives a framework which both the client and counselor can refer to have a clear understanding of the counseling process. It reflects a mutual understanding between the client and counselor regarding their respective roles and responsibilities, and also about the characteristics, conditions and procedures of counseling, including the fees and ethical guidelines. Thus, structure provides a sense of objectivity to the counseling relationship and the counseling process. It helps clarify counselor-client relationship, provides a direction to counseling process, protects the rights, roles and obligations of both counselor and client, and ensures the success of counseling. Structure is provided throughout different stages of counseling. However, it is more important to provide the structure of counseling in the beginning itself, so that client is well aware about what to expect from the counseling sessions and does not have any unrealistic expectation. Structure helps the client to know the time limit of the session, action limits, i.e., what to express and how to express. For instance, he is allowed to express but cannot be offensive, use abusive language or harm self or the counselor. Role limits, what is expected of the client and the counselor, and procedural limits, client is required to work on specific goals or needs during the counseling sessions. Thus, structure helps to bring in some sense of order for the client who is otherwise faced with confusion, chaotic situation and conflicting issues in her/his life. The counseling process is also influenced by proper use of counseling skills by the counselor. The bonding between client and counselor with open listening and unconditional acceptance helps in exploration of problems and getting the awareness and insights on issues. Sensitivity and expertise in the use of counseling skills will provide the opportunity to the client for reflection, emotional catharsis and emotional vent out, which fastens the healing process. Learning new models and ways of thinking helps the client to get empowered to deal with his/her life. The process of counseling moves forward smoothly if the counselor and the client know the boundaries of the relationship and what is expected. The counselor can be flexible and discuss the nature of the structure as per the need of their client. 2.4.3 Client Factors. The therapeutic relationship between the client and counselor depends on how they perceive each other. The client who actively participates in the counseling process have more successful outcomes from counseling than those who are passive. So the initiative taken by the client is a crucial factor in determining the outcome of counseling. It refers to the motivation to change. Those clients who have positive expectation and faith in the counseling process and counselor, they are more likely to continue in counseling and achieve success in counseling. An important aspect here is the source of referral, whether the client is self-referred or referred by a third party. When self-referred or the client has come on her/his own, it is assumed that the client will take initiative and be motivated to change. However, this may not always be the case in referral by others, parents, teachers or school administrators or office boss. There may be reluctant clients or resistant clients. Reluctant clients may be there in referral cases, however, resistant clients can be in both self-referred and other referred cases. A reluctant client lacks motivation, is reluctant and does not take initiative. They do not want to be in counseling. They may report dissatisfaction and prematurely terminate the counseling. Resistant clients are those who may want counseling but are unwilling, unready, or opposed to change, and want to avoid the emotional pain, change in perspective, or enhanced awareness that counseling demands. If the client is not involved in the counseling process or not doing assignments or work to change their thoughts and actions, they are being resistant to the counseling process. In such cases, the skill of the counselor becomes very critical. There are several ways in which counselor can help the client to stop resisting and make them initiate and achieve success in counseling. The counselor should be ready to anticipate some level of anger, frustration and defensiveness from the client, which will help them to be more accepting, receptive, patient and understanding. When the counselor shows understanding, caring and non-judgmental attitude, the client feels accepted and is open to listen and participate in the counseling process. Once the relationship is formed, the counselor may use techniques of persuasion, confrontation and other techniques to make the client work through. Client's level of motivation, his/her personality, attitude, beliefs, intelligent, socio-cultural background, age, gender, educational status, comorbidity, etc. all can have an effect on the success of the counseling. The counselor must understand the client and his/her background, verbal and non-verbal communication. Cultural background of the client needs to be kept in mind while evaluating the non-verbal communication, such as body gestures, postures, eye contact, facial expression, etc., as these may convey different meanings in different cultures. Further, the stigma associated with being in a counseling session, especially in the Indian context, may prevent the client in continuing or getting involved in counseling sessions. 2.4.4 Therapist/counselor factors. The counselor has an important role to play in the outcomes of the counseling sessions. Their personal and professional qualities are very important in building up the relationship with the client. There are a number of qualities which a counselor should possess in order to be more effective, such as they need to be encouraging, supportive, patient listener, warm, accepting, empathetic, and non-judgmental, and having positive regards for the client. All these qualities of the counselor are more likely to create the right conditions for success. They should also be interested in helping people. Apart from these, he should be well trained and expert in the methods that they practice, with a high professional ethics. Okun and Kantrowitz specified 5 important characteristics a counselor should possess. These are self-awareness, honesty, congruence or genuineness, ability to communicate, and knowledge. Clients also look for expertise in the counselor. Counselors need to communicate in simple, jargon-free language, where appropriate attire, and show genuine concern and interest in the client without being bossy, lecturing or criticizing the client. Most important, counselors need to develop a trusting relationship with the client, which can serve as the foundation for the client to open up and share things with the counselor. 2.5 Ethical guidelines in counseling. Counselor, like other professional, also do have ethical responsibilities to follow because they deal with the human beings and their interaction and decisions can harm or heal the client. Counselor's own attitudes, beliefs and behavior can affect the decision-making and direction of the counseling process and hence the outcome of the counseling. Counselor's thoughts, actions or behaviors are guided by their own moral values, personal and professional ethics and legal procedures. Without having the knowledge and awareness of these, the counselor may harm the client unintentionally. Therefore, it is very important for counselors and all helping professionals to have the knowledge of professional ethical guidelines. Before we move towards explaining ethical guidelines, let's understand what we mean by ethics. According to Kitchener, ethics means making decisions of a moral nature about people and their interaction in the society. Ethics are normative in nature and focus on the principles and standards that direct relationship between counselors and clients. Akinade, 2005. The important point to remember supporting ethical responsibilities of counselor is that he must act in accordance with the client's rights. Purpose of ethical guidelines. Ethical guidelines help us in many different ways. These serve to provide certain basic guidelines for the professional behavior of the members. There are many ethical and legal considerations which needs to be followed by the counselors as helping professionals. Ethical guidelines helps the professional counselors to regulate themselves and function independently. These ensures competent professional behavior, clarify members' ethical responsibilities and avoid malpractice in the profession. Ethical standards helps to deal with ethical dilemmas, build professional character and virtues. These also can protect the professionals in case of legal procedures and precedents or processing the ethical complaints. These also help control internal disagreement. These help in establishing principles for behavior and best practices among its members and serve as an ethical guide promoting the values of counseling profession. Ethics are guidelines that are based on the basic principles of the counselor/practitioner code of ethics. Corey briefly outlines 5 principles on which therapeutic boundaries are based upon. Beneficence. The principle of beneficence says that counselor should act in the best interests of the client based on his/her professional assessment. The counselor has the duty to see that he is competent and provide services based on adequate training or experience. The paramount goal of counselor is to work in the best interest of the client. The counselor have the responsibility for promoting or doing good for the client with the anticipation that the client will benefit or get healed from the counseling sessions. Non-maleficence, doing no harm. The counselor must avoid at all times, even unintentionally, any activities or situations with the client that could harm the client or cause a conflict of interest. Hence the principle of non-maleficence is considered one of the most critical of all principles, because not doing good is okay, but doing intentional and / or unintentional harm to client is unpardonable. It involves avoiding physical, emotional, financial, sexual, or any other form of client exploitation. The counselor should avoid incompetency or malpractice, providing services when unfit to do so due to illness, personal difficult circumstances, or intoxication. The practitioner / counselor has an ethical obligation to do his / her best to alleviate any harm caused to a client, even when the harm is unavoidable or unintended. Counselors have a personal responsibility to challenge, where appropriate, the incompetence or malpractice of others, and to help in any investigation pertaining to professional practice. Autonomy. The counselors must believe that the client is capable of solving his or her problems, and ethical responsibility to encourage client independent thinking and decision-making, and to deter any kind of dependency of the client on the counselor. Justice. The counselor must commit himself / herself to provide an equal and fair service to all clients regardless of their age, gender, race, ethnicity, culture, disability and socio-economic status. Thus the principle of justice states that a counselor / practitioner needs to be just and fair to all clients and respect their human rights and dignity. He should not discriminate the treatment to the client based on their caste, creed, region, religion, educational and / or socio-emotional status. Counselors have a moral duty to ensure a fair provision of counseling and psychotherapy services, easily approachable, available, and appropriate to the needs of potential clients. Fidelity. Being honest and trustworthy with clients and authentically honoring the counselor's commitment to the client's progress. Some of the ethical standards that need to be practiced by professional counselor are: informed consent needs to be taken before beginning of the counseling sessions, where the client is provided with all relevant information pertaining to counseling. The client must have the capacity to make a rational decision. He / she must be able to comprehend the information, and consent must be voluntary. The counselee or client should have the freedom to decide about their participation without any coercion or excessive incentive, or without any penalty, and the freedom to withdraw from counseling or psychotherapy once it has begun. Confidentiality of the client should be maintained. Whatever is shared between the client and counselor should remain intact and will not be shared without the consent of the client. There are certain exceptions to maintaining confidentiality in case of a likelihood of physical harm to self, for example, suicide, or harm to others, for example, planning to kill others, illegal actions, evidences to be submitted in court cases, or child abuse. Record keeping. Counselors have an ethical duty to secure their records in a safe place with restricted access without compromising on the confidentiality and maintaining the privacy of the data. Extra security measures can be used, such as using codes, numbers, fictitious names to keep notes from identifying the client. Privacy is the right of the client. The counselor should make sure that the physical privacy is maintained of client. If the client is talking and sharing / he should have separate place where others don't have access to intrude. Alleviating clients' distress and suffering should be the only agenda of the counselor, and not gaining some personal favors or rewards or build personal relationships for benefit of self. Integrity of the practitioner-client relationship is important for building up the therapeutic relationship. Trust and respect are fundamental aspects in any relationship. The basis of trust and respect is integrity. If this basis or foundation of integrity is damaged or fragile, it is impossible to build the required trust to maintain a successful and positive relationship. Respect for human rights and dignity. Counselors should be sensitive and aware about socio-cultural background of the client and respect the client's views and opinions without condemning them or being judgmental. Professional competence and skills are essential. The counselor and the company which hires them must ensure that they are qualified and trained appropriate to the position they are hired for and should have license to practice from a recognized body. The counselor should practice within the limitations of his/her competency. In case he feels incompetent to deal with the client, he should either consult his/her supervisors, or more experienced professional colleague, or refer to someone more competent. Self-respect and self-care of the counselor. It is the counselor's duty to promote self-awareness and have good physical and mental health. The principle of self-respect means that the counselor takes care of her/his own needs. The counselor should also seek counseling or therapy for her/his personal issues and engage in opportunities for personal and profession development. Multicultural competence. Counselor needs to be sensitive to different cultural context, beliefs and practices to create a conducive and effective counseling climate. Disregard and / or non-consideration of specific culture of the client will hamper the counselor-client relationship, and the entire counseling process may seem alien to the client. This is an important part of ethical practice in counseling, that the counselor has multicultural competence in providing counseling to people from different cultures. The ACA Ethical Standards has outlined multicultural guidelines, both in the practice of counseling and also in the training of counselors. For instance, aspects of confidentiality, assessment, training and supervision etc. need to include multicultural / diversity competence so that counselors develop perspective from other cultures also. The focus in multicultural competence is mainly on 3 areas: awareness of oneself, knowledge of multicultural issues and contexts, and culturally specific techniques. 2.6 Let us sum up. In this unit you learned about the process of counseling, its importance and characteristics. The counseling process progresses in definable stages with recognizable transitions. There is a natural development that takes place within the context of the helping relationship. The first important stage of building relationship or rapport is marked by laying foundations for trust, establishing the structure and forming the counseling / therapeutic relationship. The next stage focuses on identifying the problems and issues with the help of different assessment methods such as case history, interview, and which leads to diagnostic formation. Setting the goal and implementation of the intervention helps the client to get empowered in the next stage of working in a counseling relationship. The last stage includes termination and follow-up, which is the end of the professional relationship with the client when the session goals have been met. Counseling cannot be considered complete and successful without the follow-up procedures. There are many important factors that influence the counseling process, such as the physical setting or contextual factors, structure-related factors, and factors related to clients and counselors. Counselors deal with human beings, which requires that they should work ethically and follow certain ethical guidelines laid out for them.